Hi everyone, today's October 27th, 2021, and I happen to be here getting a treatment, and you can show the treatment, honey. My wife is filming this, and the purpose of the video today is not the treatment that I'm getting, but it's the treatment that we just gave this gentleman that I'm looking at. His name is Jean, and he is a long-haul COVID patient. He had COVID when?
March 2020.
You can get close to him. He had COVID March 2020, and tell the viewer what happened to you.
Right, so I had a very mild case of COVID infection. In 27th of March 2020, I fell ill. I had no fever. It was a very mild illness, the mildest I'd ever had, but it was clearly an unusual illness, and my housemate had just had his sense of taste and smell disappeared about 4 days before I had my symptoms. So yeah, that's what happened initially.
And then what happened? What happened after that?
Yeah. So I made an apparent recovery. There were signs that things were not completely normal, but I ignored those signs, such as bad sleep, waking up very early in the morning around 5:30 a.m., feeling very congested and a little bit like hungover, and other signs such as very painful lymph nodes, a couple of episodes of that. Basically, I thought I'd made an apparent recovery for 2.5 months. And after a particularly strenuous week of exercising and working a lot and going out as well, I made a very sudden relapse. It was the evening, on a Friday evening. I was sitting on my sofa and I felt a wave come through my body, a little bit like when you come down with a vicious cold and you feel it creeping up on you. It was a similar feeling to that, but more faster. And then following that on, I was extremely sick for, well, it's been 1 year and 4 months now. I'm considerably better, but there were some very difficult months. Maybe bedridden. I was bedridden for about 8 hours a day for 2.5 months. I had all sorts of symptoms, pains, and...
What were you like when you came to me last week?
So I came to Dr. Rowan last week. The remaining symptoms that I was feeling then, brain fog, very, very debilitating and frustrating, fogginess in the mind. It had been stronger, it was getting better, but it's still very much felt. Strong tinnitus and hair loss. These are the 3 remaining symptoms.
How about fatigue? Was there fatigue?
Yeah, there was fatigue as well, obviously. As part of the mental tiredness, yeah, I'd sort of need to have a nap every day for about an hour to be okay, to function properly. Well, function as well as I can. I'm also on a treatment now. Should I talk about that treatment?
Yeah.
I'm on a treatment that's been devised by Dr. Bruce Patterson, who's been researching long-haul COVID for the last 1.5 years or more than that, and who's made very good, incredible research actually, showing the deep mechanisms of this illness. Should I go into that a little bit?
Not into the mechanisms, but what treatment are you getting? So
his treatment involves taking a drug called a CCR5 antagonist called Maraviroc. It's an antiviral. It's used in HIV. The purpose of it is to prevent infected monocytes, which carry viral debris, from binding to endothelial cells of the blood vessels. So long COVID is actually a vascular inflammation disease condition. So Maraviroc, and then we have
you're on a statin?
Statins, pravastatins, not atovastatins, which are a lot worse for people. Pravastatins, baby aspirin, 81 milligram, hopefully for blood thinning. Basically, a hallmark of this condition is activated platelets and microclots. and they prevent good oxygenation of tissues, therefore brain fog, therefore tiredness, hair loss, tinnitus, all this makes sense. And then I have, last thing is ivermectin once every 3 days to hopefully enable the dying off of the infected monocytes. Ivermectin is 9 milligrams every 3 days. Right, so that's the treatment I'm on. It actually induced some side effects, in a way reinforcing my symptoms, so I was more tired and more brain fogged. And I think that's normal. I've been told by the doctor that's to be expected. It's a 6 to 8 weeks treatment, and I'm 2 weeks into it.
Okay, now you came to me. Well, I wish I videoed you the day you came to me, because you looked miserable. You looked like a dog that had just been washed. And I'm not saying that. I think you understand how I'm saying that. And
We'll have to delete that part.
no.
I mean, it was about 10 p.m. or so, you know.
Actually, Terry, no, he looked like a cat that had just been washed. You know, cats are miserable when you wash them. Okay, he likes that. All right, you had brain fog. You told me you were absolutely miserable, and then you got a treatment. And tell the viewer, a 10 pass. What happened?
Yeah. So this was my first ever ozone therapy treatment, which I've researched more since. It's called 10 pass IV ozone therapy. I actually also received what is known as Biocean here in the United States. In France, it's called Sérum de Quinton, Quinton serum. It's basically electrolytes, you could say. It's all the essential
Trace minerals.
Trace minerals
From the ocean.
And glutathione, which is the best antioxidant, intracellular antioxidant that you can have. So yeah, first time I was doing IV ozone therapy, pretty much immediately I felt a difference, and the next day I felt clearer in my mind that I'd felt in a year and a half. Essentially, it completely cleared up my brain fog, which was a revelation and almost miraculous. I don't really believe in miracles in any way, but I've got to say that I didn't think it would be possible to find something that would have such an immediate effect on a symptom that had, you know, been so frustrating to me for so long. So that was really something. The tinnitus is still here. I believe the treatment I'm taking is still having some side effects. I'm still a bit tired from it, but the energy was better, but it was not normal. But there's a clarity of presence and ability to focus for longer, and improved energy, definitely.
Improved energy. On a scale of 10, if you had 0 energy when you came in and 10 is normal, what do you give me?
Well, I'd say, like, following this treatment, I was maybe at like 95% or 90 to 95%. It's very hard to say that, because yeah, it's very hard to put numbers on those things, but in terms of presence of mind, I was pretty much normal.
That's the most important.
Yeah, but then the question is, does it stick? Is it going to stay that way? You know, the root cause of the illness is understood. Has ozone therapy, does it have the power to actually, you know, eradicate viral debris, heal, you know, the deep cause? That's another question.
How many of you have?
I've had only one.
You've only had one treatment?
One treatment.
All right.
No, actually I just had another one today.
Okay, here's the thing. All right, I'll try to, for the viewer, I'm going to give you my take on this. You had one treatment, and the improvement in your brain fog has lasted for days.
Yeah.
And your energy is better.
Yeah.
And your presence is better, and it lasted for days. It didn't go backwards.
No.
And you got another treatment today. This is my thoughts. Ozone works on all of the mechanisms of what happened to you, and all of the mechanisms of the acute disease itself. It oxygenates, it improves blood flow, that's called blood rheology. It improves oxygen uptake and consumption, which means energy. It knocks out viruses and bacteria on its own, and it modulates inflammation. So if we're modulating inflammation, that alone is going to help your brain fog dramatically. In my experience, this is a lasting treatment because we treat Lyme disease a few times in a patient. In most, not all. We fail in Lyme disease sometimes, not commonly. And after 4 or 5 or 6 treatments, the patients are better long term. Now, in your particular case, you've got complicating factors. You're on an antiviral drug. That's a toxic. Antiviral drugs, by definition, are interfering with nuclear metabolism, by definition. You're on a statin. Statins interfere with mitochondria.
We can argue about this.
We'll argue with that. You may disagree with me. I think they do.
No.
They also deal with calcium metabolism too.
Well, which ones though?
I think all of the statins have similar problems, but we can agree to disagree. In any event, you're on several drugs, and they can participate in toxicity in you. So you have a doctor that you're working with, and I'm going to, and that's not the purpose of this video, is to get involved in a discourse or a debate on things. My own feeling is that you had I'm really happy, you've had a stunning response, expected actually, in my book. And I really appreciate you allowing us to make this video. Do we have your permission to post this on YouTube?
You do.
Say.
You do.
Thank you.
It's getting a bit long. You might want to edit it a little bit. But
Yeah, the cats, looking like cats.
Is there anything else that you might want to tell the viewer about what the ozone has done for you?
Well, just that it was a completely new therapy to me, and I've been very, very impressed, and I intend to continue when I go back to Europe. I'm hoping to especially carry on once I'm done with my current